All right, so some people might be feeling a little bit of the pressure. School's in full swing now.
Yep. No, we are hopefully feeling settled into these routines. It's never easy, but it's always, it's always nice when they do really take hold.
Yeah. There's always, for parents who might be feeling it, sometimes some unexpected little things thrown your way that you're trying to navigate. One of these, a letter we got stood out about drug use, pot use. I want to read it to you. It says, "Dear Dr. Lisa and Reena, last fall, my 15-year-old son was put on probation for smoking pot in his high school bathroom. He seemed to take the consequences seriously. His school does random drug testing, so he knows that if he tested positive, he would be kicked out of school. He recently passed a random drug test to my great relief. Then last night, I caught him smoking in his bedroom. I feel as though I've tried every method to reach him and express the risks of this path that he's starting on. I've talked to him about brain cells. I've talked to him about being an example for his younger brother. I've talked to him about his amazing personality that most kids would kill for. I ask him about his stress and anxiety and if this is the cause of his experimentation. I don't want to scream at him because I know it does nothing. But what can I do to reach him?" Oh my gosh, I love this letter on so many levels, but bottom line, Lisa, how does this parent deal with this?
This is a tough one. I mean, there's a lot to worry about here. And what's also clear from the letter, the parents already tried a lot of things. And, asking them questions about, is this about stress, anxiety, like where's this coming from? And the kid's already gotten in trouble for it. Like he doesn't really have room to work if he wants to stay at his school. And I think let's rest for a minute on the school's role in this, which I have no problem with. I think it sounds like they've handled it quite, from what she's, is in the letter, quite.
You mean
quite
about testing?
Yeah, so there's a couple things that's happened. So one is the guy was smoking marijuana in the bathroom at school, which is an interesting choice to make, right? To be smoking weed in the middle of the day at school. And they caught him and they put him on probation. And so part of what I hear already in that is that this is a school where they're trying to take a more restorative approach, clinical approach, like, okay, you shouldn't have done this, but we're not going to kick you out cold. A lot of schools, certainly private schools can do this. We just kick a kid out cold on something like that,
wow.
if, could do that. So they haven't done that. But it's also really interesting that the school engages in random drug testing because that is not something that all schools do or can do. And the way I know schools tend to do that, if they do that, is through hair samples.
Oh, really?
Because it's not like you're going to ask kids to pee in cups at school, right? So hair samples can be taken randomly that allow whoever takes them to get a very clear sense of, what use has been in place, what's been used. And I have to say, I'm a huge fan of schools doing this. And I'm sure for some people it feels really intrusive or weird. But what I like about when schools can set this up, and I know some schools in my area who do this, is that it gets back to actually something we were talking about in the last episode around like being able to blame your good behavior on adults.
Mm-hmm.
It is such a gift for a school to give a kid. So if a kid's at a party and someone's like, "Do you want to smoke some weed?" And they'd be like, "I totally would. But here's the thing. My school does random drug testing. And so I can't, right? Because at any moment I could get caught." And that's a real present to the teenagers in that school because then they save face.
Wow.
And they have this sort of universal way to be like, I don't know if they're going to test me or not, but I can't take my chances.
I'm on the school soccer team. I've got grades. People can understand, like, I can't go there. I've got too much on the line.
Absolutely. So I just want to unpack that a bit because it's a really important aspect of caring for teenagers is whether we're going to have policies like that. Okay, so now, Reena, you just said something that I'm interested in thinking down that road about, like, kids being invested in things and so not using as a reason in the name of protecting those things, right? So you said, like, my grades, my soccer. So one way this parent might approach this boy is really from the standpoint of what does he want for himself? Like, what are his own ambitions, whether they be academic or athletic or artistic or, what does he care about? And I'd want the parent to dig into that a little bit. Like, are there things he's really caring about? Because another way to try to talk kids out of messing around with substances is to point out to them how substance use will undermine their performance in things. Like, separate from the legal or the moral, it undermines performance.
How do you explain that to them?
It's tough. I mean, the first pass at it is to say, look, you want, I know you have ideas about where you want to go to college that require certain grades. Like, it's gonna be harder for you to get those grades if your mind's all fuzzy from, smoking pot, or full well that you're not actually as capable on the soccer field if if your sleep was disrupted by smoking marijuana, which often marijuana can be quite disruptive to sleep. So making that case, so it's not about the parent, like, do it for me or do it because I say or do it because, it's not legal. Do it because, and by do it, I mean, like, stop smoking weed because there are things you care about and the weed's going to get in the way. Mm-hmm. Mm-hmm. So that's our first pass at it. What is tricky, and I think it's not always comfortable for adults to grapple with this, is that the teenager may either think, they will certainly almost think it, and may well say, yeah, okay, but the kid who's getting the best grades at school, that kid's smoking plenty of weed, right? Or the star athlete, I know full well on the weekends is getting high or drinking. So when we say to kids, you have things you care about, you don't want to mess those up, part of what we sometimes come up against is they're like, yeah, but I'm working with a different data set than you are, and it's not clear to me that what I'm doing is actually going to get in the way of my performance.
I want to go back for a second. Why do you, I know you don't know the circumstances, but what makes a kid smoke pot in the bathroom? Like in this letter, the mom at the school, the mom said, like, I asked about anxiety and stress and like, why, I guess is the question I have.
Yeah, well, it's a great question. And I will tell you, you're flagging something that I also had like a whoa about. So I know the kids use marijuana at school, and often what they're doing is they're using vape pens. They're using dab pens, as they call them. So it's, no kid today, unless they really want to get caught, is smoking a joint at, anywhere, basically. Yeah. I mean, because they smell, they're messy,
yes, exactly.
Right? So it's very easy for kids to use marijuana in a stealth way, either through edibles or through vape pens, that are pretty easy to hide and don't really, they may or may not be any smell at all. So one question, I don't know the answer, but I think you're asking a really important question of, like, why does this kid need to be high during the school day? And so what it makes me think is, does this kid really want to be at this school? And especially given that he's now smoking marijuana again, knowing full well he's on probation, and knowing full well that his school does random drug testing, I think another angle this parent may have on this is saying, buddy, you're doing a really good imitation of somebody who doesn't want to be at that school. Like, should we talk about that? Because he really is pushing it in terms of his ability to stay at the school. And so maybe the explanation for why he's getting high in the middle of the day and the explanation for why he's, really rolling the dice on whether he can stay, maybe those are both explained by him not wanting to be there at all and being miserable during the school day and so getting high to get through it, and then being so miserable that he's like, kick me out, please, right? Like, I don't want to do anything really naughty or really destructive to other people.
Yeah.
I'll just keep smoking weed till you show me the door, right? So I think that's a conversation worth having.
Interesting, because the mom says, this kid's got a great personality, like, that kids would kill for. So it's not like this is some wilting flower who doesn't have much going for him, right?
Well, we don't really know, right? Because that's the other thing. Like, it may be that in some settings, he's, able to really be this awesome kid that he is, but maybe he gets to school and things aren't okay. It's like, I think there's so many variables in this that would be important to unpack. But I would definitely, I think if we kind of think of, like, almost like these are balls coming across the plate, like, what are the swings we have available to us? So one is, do you care about stuff? This is going to get in the way of the stuff you care about. Another is, do you not want to be at this school? And are you trying to make that happen?
Interesting.
But I think there's a few more.
So, the mom said she's tried everything. She doesn't want to be the yelling mom. She's tried to get him to understand and rationalize with him and say you should be a great example for the younger brother. But it just seems like this mom is doing everything in her power to get it right. Is there anything else that you could help her strategy-wise with?
Well, there's something else in the letter, and I'll tell you, it was the thing that actually was the biggest red flag for me in this letter was that he's smoking alone in his room. It's a really different profile, Reena, and you'll instantly see this. Kids drinking or smoking with their friends on the weekends versus kids drinking or smoking alone at any point.
What does alone mean to you when you hear that about substance abuse?
It means there's something bigger going on. Like that it's, that there's it's not unusual. And it never has been unusual, Reena, right? I mean, we were teenagers too.
Yeah, of course.
That when kids get together on the weekends, they're like, yeah, sure, we'll do it, and not like, I'm not saying like, that's fine, that's a sign of great health, but like, it's not nearly as concerning because it feels like it's driven by, a wish for belonging. It's maybe driven by a sense of like enjoying one's friends and like being a bit naughty together, right? Like there's a lot in there that I'm like, yeah, that's sort of adolescence. And like, it's scary to grownups, but it's not outside the normal range of what we expect to see in teenagers. When I hear about a teenager who's using on their own time and it's not in a social context, what I think is, that kid's in pain. Like that kid's in pain about something and they are using the substances to manage it.
Oh, interesting.
So I think another pass on this might be to say, buddy, you got to be in pain about something if you're in your room smoking weed alone, right? Like that is concerning. I'm going to get you evaluated. I want you to talk to somebody. And then what I would have this parent do is check in with their pediatrician or their resources in the community and find the clinician, and there's usually, hopefully one or two in the community, if not more, who's very good at evaluating substance abuse concerns in adolescents. That's a specialized thing. Yeah.
That specialty matters, finding that particular person.
Absolutely. And so I would say you need to talk to this person. Like I need you to have an evaluation with this person. And hopefully they've got a good person they can find. And I've got my people in town where I will refer out. And what I like about these people, they do a few things. One is they're good at getting kids to talk about their use in honest ways. They have, it's no surprise, people of all ages, when they are being asked about their substance use, if it's a problem, they're not usually all that honest, right? It's not a place where they're like, I'm so glad you're asking, let me tell you the whole story. So they are very skilled as interviewers in terms of going about the situation in a way that they can usually get pretty decent information. And what they can do is they can start to tease apart, is this about an underlying depression? Is this about an underlying anxiety disorder? Is this about a past trauma? Is this about something else? And then what they can be very good at is thinking about order of treatment, right? Would it help to get this kid into psychotherapy? And if they got help around the mood or anxiety or any other diagnosis, would that then reduce the necessity of using? Or does this kid actually need to be in a program where the use goes away, right? Like where they have to go cold turkey because we can't even begin to assess what's going on while they are still using, or they're not going to get better for whatever mood or anxiety or other diagnosis we're concerned about if the marijuana is still in the picture.
So, one of the things we hear over and over again, and one of the huge reasons you wanted to start this podcast was it's hard for people to find the right help sometimes, right? And being able to talk about these issues helps parents deal with it. But I'm thinking, I don't really want to go to the school psychologist, and my kid probably doesn't want that dealt with at school, even if it would be private. So what do you recommend if people might need this help? What's the best way to find resources to deal with this?
Yeah, so definitely your pediatrician's a good place to start.
Okay.
Sometimes parents can use their own general practitioner, right? So they might reach out to their own physician and say, who do you like for this in town? Because often they'll have a good sense. You could certainly look online in your community, for substance abuse evaluation, for adolescents. That's how I would search it. You could also feel something out. Like you could see if you could meet with the person first and get a feel for it. So there may be ways to triangulate on this. Now, the other way, Reena, this conversation I would not be shocked if it went this way, is if the parent said to this boy, you know, you're smoking alone in your room. I think you're really sad, or I think, you know, something's not right. Mm-hmm. And the kid's like, yes, and this is how I self-medicate, right? Like that's often what adolescents will say about their own marijuana use is, no, this is me self-medicating. Mm-hmm. And I have to tell you, Reena, like it bums me out so much that the term self-medication lends itself to the use of it being a good thing. You know what I mean?
No, explain that.
Well, I think when clinicians use the term self-medication, like this person has taken it upon themselves to reduce their anxiety by being high a lot, implicit in that is like, we don't think this is a good way to medicate. Like if you're going to medicate that anxiety, like don't use drugs to do it. Like
right.
we have other ways to treat it. But I have seen in some teenagers taking that up as like, this is me taking care of myself. This is me addressing the problem.
They think it's positive.
Yeah, like I'm self-medicating. Like I'm you know, I'm handling it. Mm-hmm, mm-hmm. And unfortunately that word medication, you know, and I'm not blaming anyone in this. I'm just sort of like noticing the ways in which it can lend itself to that use of like addressing the problem, medicating the problem, taking care of the problem.
Yeah.
And so what I'm trying to think through is, what does this mom do if the kid's like, yeah, I am bummed, and no, I don't want to leave my school, but I've been down, and this is me self-medicating. And they say it in that kind of like, so what's it to you, kind of way.
Right. Wow.
And so then I think what we'd want is a parent to say, it really, really matters that you are in pain. And
acknowledging the pain is what you're saying.
Absolutely.
That's important to say, I get it. I see that you're in pain. I acknowledge it. Why is that so important to say that?
Because I think we can get stuck on the reaction to the pain.
Totally.
Like, you can't smoke weed, right?
Totally.
So I think you want to align. You want to say, like, okay, you must be in a lot of pain because, like, you are not the kind of kid who wants to get kicked out of school. Or you are, like, I know you. You're a great guy. You know, you've got this fabulous personality. Like, you've got to be in quite a bit of pain to be smoking marijuana in your room by yourself. Like, I hear that. And then, Reena, I think what we take it back to is coping, which is marijuana does provide coping, right? If you get high or drunk, you will not feel as much pain. Like, we have to acknowledge that. But then I think what we need to make clear for teenagers is the goal here is to cope with our pain in a way that doesn't have downsides. And there's a lot of downsides to smoking marijuana.
And so with that in mind, what else can the mom do at this point?
She may have to articulate the downsides again. I hate to say it. Yeah. And I think part of it, I mean, this is so interesting to me, Reena. Like, teenagers are like, weed, alcohol, like, what's the difference? And they're not entirely wrong. Like, right. I mean, we've done studies on societal harms and, like, you know, they're not altogether wrong. But they can see it as sort of a nothing burger. Like, everybody smokes weed. Like, you know, you guys drink wine on the weekends. Like, what's the big deal? So I think to just say, like, let's just be clear. Like, you are coping with pain in a way that has neurological implications for your learning and your attention that could get you kicked out of school, that may be undermining, like, whatever it is you want for yourself in terms of, you know, performance on any front. And also, let's also remember, is not even legal, right? So, you know, you could really end up, you know, in a bad spot here. So this can't be how you cope with pain. There are too many costs. But let me put some options on the table for how you could cope with pain, right? We can get you a therapist. If you don't like that idea, we can, you know, you can put some other things on the table that would help you feel better. Like, is there something we can be doing differently at home? Is there a program you want to sign up for? Something you've been wanting to do that you think would help you feel better, right? Like, it's not about the pain. It's about how it's getting managed and finding a way to manage it that brings relief but doesn't cause harm to this kid is, I think, the next goal.
So finding relief that doesn't bring harm to this kid. Okay, that's really good. What else do you think parents need to know about being in this situation?
Well, I could also see a kid who's like, I'm not in that much pain. I just don't want to stop smoking weed. Like,
really?
I just like it. Yeah, totally. I could totally see a kid be like, I like it. And like, what are you going to do about it, right? And that's, I think, would be the hardest route in many ways. And I think that's where the parent has to make a decision about how bluntly aggressive they want to be in preventing this kid's ability to use. And they could say something like, you know what, I love you, and you're 15, and I am sticking up for the 18-year-old version of you who I think really would have wanted me to throw down about this and really would have wanted me to get you off of this path. And so here's the deal. You can't smoke anymore, and we're going to start testing you weekly.
Wow.
And families can do that. I mean, and they may need to call their pediatrician and figure out, what that's going to look like. And that would probably involve urine sampling. But the family may say, we're not budging on this. Like, there's too much at stake. It is too potentially costly. Like I see right now, it doesn't feel like it's costing you a whole lot. And that may feel true for the kid. But you got one brain for the rest of your life, and we don't feel like we're doing our job as a parent if we knowingly allow you to continue. So we're going to start testing you once a week, and you can't use. And that might be a place to start.
So this might be an incredibly inappropriate question, but, I think kids are looking and seeing marijuana legalized in many states across the country. How do you come back to a kid who's like, look, I'm not doing Molly in my bedroom. It's just pot.
It's not inappropriate at all. That's exactly what kids will say. Like, are you kidding me? Like, I'm not, like, and they'll often say, like, and I'm getting good grades. And I'm like, why are you making such a big deal of this, right? Yeah. Like, that can be a position a kid will take.
Well, I guess the way I felt it was inappropriate was, is there ever a point where it's like, oh, they're just doing pot, it's okay for a teen?
Oh, I can't say yes.
I know this is a tough question.
Yeah, but there are degrees of worry, right? I mean, if you, stop me on the street, random person stops me on the street and is like, okay, Lisa, let me paint a picture. Here's a teenager who twice in high school or, on alternate months, on the weekend with friends, occasionally smokes what they know to definitely be marijuana, and, they do it under incredibly safe circumstances, is that okay? I'd be like, well, they're not going to burst into flames, right? Like, this is not going to likely derail their universe if nothing else is going on. That is the honest answer. At the same time, we got to mention the weed is different now than it's ever been. That the concentration of what's available to kids is much, much higher than has ever been available in the past. And so I think it really then further clamps down on that question of is any use okay? Because even if they know for sure that they're smoking marijuana, and of course, who knows what they're smoking, right? I mean, that's the other thing. It's not like they're getting this at their pharmacies, right? They don't really know what they're getting. So that's a whole other ball of wax, not even worth it to get into today. But let's just say they are smoking marijuana. The marijuana they're smoking is very, very powerful, very, very intense. And so we can reasonably extrapolate that whatever brain damage we know marijuana can cause, it's not going to take as much marijuana as it used to get you there, right? So that's a conversation to have. But you said the essential thing, which is kids are watching legalization all around them, right, which makes it really hard for parents to be like, actually, this is a big deal. This is a big deal. And so one way that a parent might kind of finesse that is to be like, I would not be okay with you drinking in your room. I would not be okay with you drinking at school. This is about you being altered. This is about you using a substance to change your mood. This is not okay, right? So that might be a way that the parent could say, look, legal schmeagle, you're using this in a way that's very worrisome to me, and I can't ignore that.
So much to unpack in this episode, and this was just a topic that went so many different directions that I didn't know things to discuss and think about. So what do you have for us, Lisa, for parenting to go?
I think that the overriding framing we want on this is that we are raising our young people to take good care of themselves. And we are handing over the work of caring for them. We used to care for them, and then we increasingly expect that they will take good care of themselves. And when they aren't as teenagers, we really do need to wade in and get in their business. And so often in these interactions around this letter and things like it, the kid's like, why are you in my business? I am handling things. And one way a parent can address that is to say, look, I don't want to be in your business. Like, I want to stand back and watch you take incredible care of yourself. But if you're not doing that, I'm not doing my job if I let you not take good care of yourself. And the minute you are taking good care of yourself, I'm out. I don't want to be here. But you are sending me engraved invitations to be in your business when you are smoking marijuana in your bedroom. And I'm not going to turn down that invitation.
So letting him know that this isn't a position you want to be in, you want to give him independence. And that might resonate.
Hopefully. But these are tricky ones, for sure.
Glad you're here to help us think it through. In next week's episode, we're going to talk about how do you help kids that don't take initiative to get them to do things on their own.
Wonderful. I'll see you next week.
I'll see you next week. Thanks for joining us. Be sure to subscribe to the Ask Lisa podcast so you get the episodes just as soon as they drop. And send us your questions to asklisa@drlisadamore.com. And now a word from our lawyers. The advice provided on this podcast does not constitute or serve as a substitute for professional psychological treatment, therapy, or other types of professional advice or intervention. If you have concerns about your child's well-being, consult a physician or mental health professional. If you're looking for additional resources, check out Lisa's website at drlisadamore.com. We'll see you next week.